The 9 most dangerous medications triggering rapid memory loss and dementia. Did you know that by the time you finish watching this video, approximately 21 seniors will receive a devastating dementia diagnosis? That's one person every 64 seconds. But here's what should really terrify you. What if the root cause isn't getting older? What if it's sitting right there in your medicine cabinet? You've been reassured these pills are safe, routine, even necessary for your health. But groundbreaking new research is raising serious red flags. 50% of seniors have absolutely no idea that at least one medication they're taking every single day could be shrinking critical memory centers in their brain by more than 29% in less than 12 months. And here is what makes this even more alarming. These are not obscure, rarely prescribed drugs that only a small fraction of older adults encounter. These are the pills sitting on your nightstand right now. The ones you take without hesitation every single morning because a doctor handed you a prescription and you never thought to question it. The ones the pharmaceutical industry has marketed for decades as safe, well-tolerated, and appropriate for long-term use. Meanwhile, the science tells a completely different story. In fact, a 2023 study published in Neurology and Aging Research discovered that one particular class of medications increased dementia risk by 48% in seniors within just 2 years of regular use. That's not a small increase. That's nearly half again the normal risk. I have seen this happen too many times in my practice. People trust their medications completely. They assume if a doctor prescribed it, it must be harmless. Meanwhile, the pharmaceutical industry has known about these devastating effects for decades. Yet they continue profiting billions of dollars from selling the exact same drugs that may be accelerating cognitive decline in millions of seniors across the country. In this video, I'm going to reveal the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from commonly overlooked to absolutely mind-destroying. And number 3 on this list is prescribed to millions of seniors for something that seems completely harmless, but it can shrink key memory centers in your brain, and you probably don't even realize it's happening to you right now. Also, I want to hear from you. Let me know in the comments. What medications are you taking every single day? And have you ever experienced sudden brain fog or unexplained forgetfulness after starting a new prescription? We're reading every single comment and replying with personalized insights based on your specific situation. Don't stay silent about this. Speaking up could literally save your mind. Now, without any further delay, let's start at number 9. And don't let its position on this list fool you for a second. This medication is sitting in almost every senior's medicine cabinet right now. It might be scrambling your brain before you even feel the first symptom. The number 9. Diphenhydramine, commonly sold as Benadryl. Diphenhydramine is that familiar pink pill that millions of people trust to help them fall asleep, relieve seasonal allergies, or ease cold symptoms. It's inexpensive, available over the counter at any drugstore, and you probably have a bottle of it in your nightstand or bathroom cabinet right this very moment. You may think you're simply taking it to sleep better at night or get relief from allergies. But inside your brain, Benadryl is actively disrupting your hippocampus. That's the specific region responsible for forming and storing new memories. Benadryl belongs to a family of drugs called anticholinergics, which work by blocking a crucial neurotransmitter called acetylcholine. This is the chemical messenger that helps your brain create new memories and maintain alertness throughout the day. As your brain ages, it becomes increasingly dependent on every bit of acetylcholine it can produce. And when medications like Benadryl interfere with that delicate process, the results can be absolutely devastating. According to a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs on a regular basis had a 54% higher risk of developing dementia compared to those who avoided these medications entirely. That's more than half again the normal risk just from taking what most people consider a harmless sleep aid. So, how can you protect your precious memory? First and foremost, avoid anything containing diphenhydramine, especially if the label says PM, nighttime, or allergy relief. These products are often just Benadryl hidden under a different name. And if you're currently using diphenhydramine for allergies, There are much newer non-sedating options available like loratadine, which is commonly sold as Claritin. These newer antihistamines do not cross the blood-brain barrier and are dramatically safer for long-term use in seniors. Never stop any medication abruptly without medical guidance, but also never assume that over-the-counter automatically means safe for your brain. Up next is a medication that's often marketed as harmless and gentle on your digestive system. Yet, it systematically interferes with the very nutrients your brain desperately needs to stay sharp and healthy. Number 8. Proton pump inhibitors, specifically Prilosec and Nexium. These medications belong to a drug class called proton pump inhibitors, or PPIs for short. These drugs are specifically designed to reduce stomach acid production and are frequently prescribed for heartburn, GERD, and acid reflux problems. Many seniors remain on these medications for years, sometimes even decades, because their uncomfortable symptoms return immediately as soon as they try to stop taking them. But what's rarely discussed with patients is how PPIs systematically interfere with the absorption of vitamin B12, which is an absolutely crucial nutrient that protects brain tissue and supports memory function, cognitive resilience, focus, and mood stability. In a groundbreaking study from 2016, published in JAMA Neurology, researchers carefully examined over 73,000 people aged 75 and older. They discovered that regular PPI users had a 44% increased risk of developing dementia compared to people who didn't use these medications. By suppressing stomach acid too aggressively, PPIs interfere with your body's natural ability to absorb not just B12, but also magnesium and calcium, which are essential minerals for neural transmission and proper brain cell signaling. Without adequate levels of these nutrients, your neurons struggle to fire efficiently, causing misfiring, confusion, and memory lapses that often look exactly like the early warning signs of Alzheimer's disease. But the problem goes even deeper than nutrient depletion. PPIs have also been scientifically shown to increase levels of amyloid beta plaques in the brain. These are toxic proteins that actively disrupt normal brain function and are considered one of the core drivers of Alzheimer's disease progression. If you're using a PPI every single day, ask your doctor whether you can slowly taper off with the help of H2 blockers like famotidine, which is sold under the brand name Pepcid. Also, chewing deglycyrrhizated licorice, which is a natural compound that coats and soothes your stomach lining, can offer symptom relief without causing any cognitive harm. Number 7. Bladder control medications, specifically oxybutynin. Oxybutynin, which is sold under the brand name Ditropan, is frequently prescribed to seniors who struggle with urinary incontinence or overactive bladder problems. On the surface, it seems like a practical and helpful solution. Nobody wants to deal with the embarrassment or inconvenience of frequent urgent bathroom trips throughout the day. But this medication works by blocking acetylcholine, the exact same critical brain chemical that's disrupted by Benadryl. And unlike some milder anticholinergic medications, oxybutynin crosses the blood-brain barrier very easily and directly affects memory regions in your hippocampus. That characteristic makes it particularly dangerous for seniors, especially when it's used over extended periods of time. In a comprehensive 2019 study published in the British Medical Journal, researchers discovered that people over 65 who took strong anticholinergic medications like oxybutynin for more than 1 full year had a 49% higher risk of developing dementia. That's nearly 1 in every 2 users. What makes this even more concerning is that the vast majority of seniors are never properly warned about these serious cognitive side effects. They're simply told the medication will help control their bladder, not that it may be accelerating the very cognitive decline they fear most. Patients commonly describe feeling mentally foggy, forgetting important appointments, constantly misplacing everyday items, or suddenly struggling to keep track of simple conversations. It's rarely connected back to the medication until significant damage has already occurred. Fortunately, there are much newer medications available, like mirabegron, which is sold as Myrbetriq. This medication works through a completely different mechanism and has shown significantly less impact on memory function and cognitive resilience in older adults. Number 6. Statins. Statins are among the most widely prescribed drugs in the entire world, especially for people over 60 years old. They're intended to lower cholesterol levels and reduce your risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold under the brand names Zocor and Lipitor, are the two most commonly prescribed versions. But here's where the serious problem begins. Cholesterol isn't just a cardiovascular health issue. It's an absolute brain necessity. Your brain is composed of nearly 60% fat, and cholesterol plays a critical role in creating and maintaining the myelin sheath. That's the protective coating that helps nerve signals travel smoothly and efficiently throughout your brain. When you aggressively lower cholesterol with powerful medications, you may also be starving your brain of exactly what it needs to function properly. In a 2023 study published in Frontiers in Aging Neuroscience, researchers found that seniors over 70 who had been taking statins for more than 3 years straight had a 26% higher risk of mild cognitive impairment. And those taking high-dose statins had even more noticeable declines in mental function, executive processing, and memory retrieval speed. Some patients reported sudden onset memory loss, describing frightening moments where they couldn't recall familiar names, recent conversations, or driving routes they'd traveled for years. Not all statins affect the brain equally. Pravastatin and rosuvastatin do not cross the blood-brain barrier as easily and are considered significantly less risky in terms of cognitive side effects. If you've been on a statin for years and you're noticing mental fog, increasing forgetfulness, or growing confusion, it might be time to have a serious conversation with your doctor about a dose reduction or an alternative cholesterol management strategy. Number 5. Benzodiazepines. Benzodiazepines, which include commonly prescribed drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are some of the most widely prescribed medications in America for anxiety disorders and sleep problems. They work by enhancing GABA, which is your brain's natural calming chemical that reduces overstimulation and nervous system hyperactivity. At first, these medications seem like absolute lifesavers. They quiet racing thoughts, ease panic attacks, and help with falling asleep. But over time, these drugs transform into something else entirely. They become a neurological trap you can't escape. A 2022 study published in the British Medical Journal followed over 8,000 seniors over a 6-year period and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk climbed even higher for long-acting benzodiazepines like diazepam, which remain in your body much longer and accumulate in fatty tissues, including your brain tissue. What happens is a kind of chemical sedation that progressively slows down neural activity, metabolic function, and synaptic plasticity throughout your brain. That means your brain stops learning new information as quickly as it should. It becomes less flexible, less efficient, and increasingly prone to confusion, memory gaps, and emotional numbness that seniors and their families almost universally misattribute to aging rather than to medication. Seniors taking benzodiazepines regularly often describe feeling like they're moving through a constant fog, feeling disconnected from reality, or just not feeling like themselves anymore. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly under any circumstances. Work closely with a knowledgeable doctor to very gradually taper the dose down over weeks or even months. Safer alternatives like buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy specifically designed for insomnia can help restore calm and peace without causing progressive memory loss and accelerating cognitive decline. I want you to stop you for a second. I want you to please like this video and subscribe to this channel. It helps us a lot. Number 4. Amitriptyline, sold as Elavil. Amitriptyline is an older antidepressant that's still surprisingly commonly prescribed today for chronic pain conditions, insomnia, and sometimes even migraine prevention. At first glance, it may seem like a versatile multi-use pill that solves several problems at once. But underneath the surface, It's actually one of the most potent anticholinergic medications still in widespread clinical circulation today. That means it powerfully blocks acetylcholine, the chemical messenger that helps neurons communicate, form new memories, and maintain the cognitive resilience and mental sharpness that seniors over 60 depend on more than ever. In a massive 2015 study published in JAMA Internal Medicine, researchers carefully examined over 3,400 adults aged 65 and older. They discovered that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. Even low-dose amitriptyline taken nightly over several years can create a slow, invisible erosion of brain power that happens completely silently, without warning, without obvious symptoms, until the cognitive damage has already accumulated to clinically significant levels. The harm presents as gradual decline that looks exactly like natural aging, but is actually drug-induced cognitive impairment that could have been prevented with a safer alternative. If you or a loved one is currently taking amitriptyline, speak with your physician immediately about safer options. For nerve pain, duloxetine or gabapentin may offer equivalent relief without the same severe anticholinergic burden. For sleep problems, melatonin or very low-dose doxepin may be used with far less cognitive risk. For mood support, newer antidepressants like sertraline or escitalopram are generally considered dramatically safer for long-term brain health and cognitive resilience in older adults. Number 3. Paroxetine, sold as Paxil. Paroxetine, which is sold under the brand name Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety disorders. At first glance, it appears to be a modern, sophisticated antidepressant. But here's the critical part they rarely tell you about. Paroxetine is the only SSRI medication that has significant anticholinergic properties, which means it interferes with acetylcholine in your brain. That one crucial detail makes it drastically and fundamentally different from its SSRI siblings like sertraline or escitalopram. In a large 2021 comprehensive review published in Frontiers in Psychiatry, researchers examined the cognitive profiles of elderly patients taking different SSRI antidepressants. They found that paroxetine users showed measurable declines in short-term memory, verbal recallability, and attention span within just the first 12 months of treatment. The study also discovered that seniors taking paroxetine were 30% more likely to show early warning signs of cognitive impairment compared to those taking other common antidepressants. The cruel irony is that paroxetine is often prescribed specifically to stabilize mood and reduce anxiety. Yet it ends up systematically undermining mental clarity, emotional regulation, and the very cognitive function it was meant to protect, defeating its own purpose while accelerating the neurological decline it was supposed to help manage. The American Geriatric Society has officially placed paroxetine on its Beers criteria list, which is a carefully compiled list of medications that are potentially inappropriate for older adults due to safety concerns. If you're currently taking it, ask your physician about switching to safer alternatives like sertraline or escitalopram, which are significantly better tolerated and don't carry the same serious cognitive risks for aging brains. Number 2. Antipsychotics. This one is especially alarming because many seniors don't even realize they're taking an antipsychotic medication. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were originally developed and approved to treat severe psychiatric conditions like schizophrenia and bipolar disorder. But today, they're frequently prescribed off-label to elderly patients for common sleep problems, mild agitation, or behavioral changes associated with dementia itself. The consequences of this practice are devastating and well documented. In 2022, a comprehensive study published in The Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors who were prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within just 12 months, even if they had absolutely no prior history of dementia before starting the medication. Even worse, These drugs dramatically increase the risk of stroke, sudden cardiac death, and severe sedation that leads directly to falls, emergency hospitalization, or permanent institutionalization in a nursing facility. These medications aggressively suppress dopamine, a chemical that is not only linked to mood and motivation, but is also absolutely critical for executive function, working memory, and the cognitive processing speed that determines how effectively the aging brain handles the demands of everyday independent life. When dopamine levels crash dramatically, your brain becomes sluggish, slow, and unresponsive. This is exactly why seniors taking antipsychotics often appear dull, emotionally flat, or completely zombified. Their personalities fade away, and family members find themselves grieving for someone who is still physically present but mentally and emotionally absent. If you or a loved one is currently taking one of these powerful medications, ask the prescribing doctor why it was prescribed and whether it is truly medically necessary. Behavioral symptoms can, in the vast majority of cases, be effectively managed with non-drug interventions like structured daily routines, reducing environmental overstimulation, addressing underlying pain, and improving sleep hygiene and lighting. Number 1. Anticholinergic polypharmacy. This is the hidden danger that almost nobody talks about, and it's genuinely one of the biggest contributors to drug-induced dementia in the elderly population. The most dangerous medication situation for rapid cognitive decline in seniors isn't one particular pill. It's the silent, creeping, cumulative effect of taking multiple medications with anticholinergic properties at the exact same time. A dangerous situation that medical professionals call anticholinergic polypharmacy. Imagine this all-too-common scenario. A senior takes diphenhydramine every night for sleep, oxybutynin daily for bladder control, and amitriptyline for chronic pain management. Each medication alone might cause only mild, barely noticeable memory problems, but when combined, they compound exponentially, and the cumulative anticholinergic burden on your brain absolutely skyrockets into a range that clinical researchers have consistently linked to accelerated neurodegeneration, measurable brain volume loss, and rapidly progressive cognitive decline that mirrors the most aggressive presentations of Alzheimer's disease. In a 2022 analysis published in Age and Aging, researchers tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the normal risk. And here's the absolute worst part. The vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications. Nobody had ever explained this to them. Now, I want to hear directly from you. Which of these 9 medications are you currently taking right now? Have you noticed any troubling brain fog, increasing forgetfulness, or personality changes since starting a new medication? Are you willing to talk to your doctor this week about reviewing your complete medication list? Share your experiences and honest opinions with us in the comments section below. We genuinely want to hear from you. Your story could help another senior avoid this same dangerous situation. Thanks for watching, and remember, I'm Dr. Michael Kent, and I'm here to help you stay sharp, healthy, and strong for all the years ahead.